All right, Town Council special meeting, March 6, 2025, Cape Charles Civic Center. If I could get a roll call, please.
Newman present.
Holloway present.
Buckles present.
Buda present.
Grossman present.
Ashworth present.
Let it be known we've established a quorum. If we could all rise for a moment of silence and pledge of allegiance. Pledge allegiance to the flag
of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, do we have any public comments this evening?
No,
All right,
and none submitted prior to the meeting.
all right, good deal. All right, so order of business this evening is for the 25-26 employee health insurance presentation and renewal.
Does anybody need an additional copy of the PowerPoint or information that was
All
in your
good.
packet?
If you've got one, I'll take it, sure.
Yeah.
Yeah, if you have a hard copy, I'll take one.
We'll just send it down. Thank you.
Here's two.
There you are.
Thank you.
You're welcome.
Although
Sure,
I
I'll
did
take
just
one.
come up with 5 bags of shred from my council stuff. Thought of you.
So exciting.
So last year, Paul asked me to do this in 20 minutes, and this year he said, I want that to be halved. My goal is 10 minutes. So I'm going to do it a little differently. What I'm going to do is just explain to you kind of what we're proposing and some of the changes that we feel are going to benefit the town and the employees. And then I'm going to kind of go through the slides fairly quickly and see if you guys have any questions. And then we can stop on a slide if you have any questions and you need clarification. This past year was our second year with Centera Health. That was a true HMO, meaning that there was no out-of-network. We had to be in-network. The feedback from the employees has been very positive. They've been great with claims, and we've had no issues. But unfortunately, the renewal was it was over 7%. That's in the slideshow, 7.8%, I think. And while overall for health insurance, that's not a terrible increase. I mean, you see groups 30% increases and much higher. So it was palpable, but when you really look at what the employees, especially the employees with the dependents, with family or children or spouse, what they end up paying, it was significantly higher than what they are paying now. And it's a stretch for our employees. So, and you have to go due diligence, you have to go to market and look around, and we have found, if we return to Anthem, and Anthem is very familiar to our employees. We've had it most of the time, at least the 10 years that I've been doing this. We've had Anthem probably more than 50% of the time. And what we're proposing is that we would return to Anthem, and we would go back to doing what's called a level funding plan, which is basically self-funding. However, there's a stop loss, so the town is never at a risk for a super high claim. Like, let's say somebody had a premature baby, and you're talking millions of dollars. That would not be good for our claim history because we might not get claims back next year, but we're safe. We're not going to have to pay any more than what we pay every single month for our premiums. So it's not true self-funded. More and more small groups like ours are going to self-funding. And this is something that I'm familiar with, and our employees, they don't know the difference. I mean, you don't really know as a participant, as a member. So then we started looking a little bit more at the level funding plans and found that if we do something called a bundle, we get 2% more of a reduction in cost. And that's a lot when you're talking, the kind of expense that health insurance is. So that would mean that we would bundle, we would be moving to Anthem Health, but we would also be moving our dental and our vision as well. Right now we're with Delta Dental. No problems with Delta, they've been great. Dental insurance in general is getting to be sticky because dentists, they don't want to participate in dental insurance. So you either have to file the claims yourself or you have to find a new dentist. And I have had a lot of employees complain that, my dentist doesn't participate in Delta Dental. Well, if they don't participate in Delta, they probably don't participate in Anthem either. But I did a lot of research on the Anthem Dental, and there were a couple things that I felt were just really strong points. One is that they have, right now with Delta, they have a $500 lifetime orthodontic benefit. So if you have a child and they need braces, Delta gives you $500. Anthem gives them $1,500. And we've got employees that have kids. I've got one that has a 13-year-old getting ready to go to the orthodontist. So that's a really big difference, $1,500 towards the dental, the orthodontic cost versus $500. They also have a larger benefit. So there's just more money available to the employees to use for their dental benefits. So it didn't seem like anything negative, like why wouldn't we change? And then I started looking at the dentists, and I started going to the employees that I knew either loved their dentist or had a lot of dental work going on or had, some concerns about dental. And I did find that all of their dentists were in network. So that made me feel more comfortable. I can't make, we, the town, can't make everybody happy all the time. Sometimes you have a doctor and they're not in network. But I think that the Anthem Dental is a very good option for the town. And the vision is basically exactly like VSP. I mean, there's no difference. They pay for frames and lenses and, your eye doctor appointment once a year. So that I don't think is going to change. I also looked online to see what kind of optometrists and ophthalmologists might be in network, and the same ones, Titcomb and Seashore Eye Care, and a couple of really good ones across the bay. So we've got good in-network. The other thing about Anthem that was a plus for us is that it is not an HMO. It is a point of service plan. So it's all over the state. So if an employee has a child in college in in Virginia Tech or in Northern Virginia, they're going to have coverage with Anthem. Whereas Centera is, as you know, it's very Tidewater centric. I mean, they do have Centera in other parts of the state, but Anthem's everywhere. And even though we're not doing we're not going to do a Key Care plan. Key Care is where you can go everywhere in the country. But if you use an in-network doctor through the point of service plan with Anthem, you can go anywhere in the country. So if you needed to go to a specialist, like you needed to go to Duke or Johns Hopkins, I don't know if they're in network or not, I didn't check that, but it's an example, top tier hospital, as long as it's in their network, in their PPO, and then you can go there. It wouldn't be any different than what you've got. So this is actually, I think, a good move for the town. We're going to have the same great benefits that we've offered. The 3 plans that we've chosen to offer are very similar to the plans that we have now. I can show you on this slideshow. We've got one which is a $4,000 deductible, which is going to be the most cost effective. A lot of employees migrate right to that because they just want the least amount out of their pocketbook, especially if you have family or dependents. Instead of a $1,500 deductible that we had last year, we're proposing it's a $2,000 deductible, but it's a really interesting plan. It's $2,000 deductible, but there's no co-insurance. So you basically have co-pays the whole time. So everything's a co-pay. So it's very easy to budget. You always know what it's going to cost. It's going to cost this much if I go to urgent care. It's going to cost this much if I go to the emergency room. It's going to cost this much for specialists, for an x-ray. So that's the rich plan. That's going to replace the $1,500 deductible plan. It seems to me that this would be a good move for the town. We are definitely going to save some money. As you saw in your presentation, it's kind of not really comparing apples to apples because we have more employees. We brought the harbor back. We had a replacement in the finance department. We're adding a new employee to the planning/code enforcement office. So, when you look at the numbers, we have to remember that we now have more employees that we're covering, but we're looking at pretty much staying flat. As far as the increase goes, there is no increase, there's really no decrease. What we paid last year is basically what we would be paying this year. and still being able to offer the HRA, which employees love that. That's just the best benefit. It means so much to the employees. We would change the funding a wee bit, just so that it would really match those 3 plans. And I think I'll just flip through the slides. And does anybody have any questions so far? Okay. All right. So, let's see here. All right, so the agenda, the introduction. So we talked about this just a few minutes ago, so I don't think I need to talk about that. These are the changes that we're proposing. As you can see, again, a little bit more expensive for the employees with dependents if we stayed with Centera. It's a 7.72 increase is what Centera came to us with. Again, we did our due diligence. That's getting together with our broker and doing the shopping, looking hard at all the different options that we had, and this is what we felt would be the best for the town and the employees. I talked about bundling. Guess what? I forgot to tell you. This is very good news. Anthem has agreed to give us a $6,000 credit. And they give that to us on the second billing cycle, which should be May. So that will more than cover the increase to the HRA, because the HRA is going to go up a little bit. So that's a nice perk to move over to them. So they want our business. And then the dental plan was a little bit more expensive. And when you read $488 per year for all employees, that's total $488 for everybody. That's not per employee, that's for everybody. So that's really not that much. And the reason is probably because they have bigger benefit and they have that amazing orthodontic. So that's why that's a little bit higher.
And the 6,000 just to entice us to sign up with them? It's a one-time kind of?
Yeah, one time.
Right.
Yeah.
Insurance. Yeah.
And that's in addition to the 2% reduction, right?
Correct. Correct.
And can employees buy just parts, or do they have to buy all of it? Let's say somebody wanted just vision, or just dental.
Parts. So all of our employees right now, all full-time employees are enrolled in dental. Everybody is, because the town pays 100% for the employee. But then we do have roughly 10 employees, I think, that waive. They have, they might have a spouse that has a federal program. We have one on TRICARE. So there are reasons that they waive. And that's okay, they can do that. Not everybody does the vision. And if you don't wear glasses, you don't need to have the vision. So yeah, it's just that we are agreeing with Anthem that yes, we will do business with you for medical, dental, and vision. That's a good question though. I asked that to Anthem too.
Can you choose dental and vision if you waive health insurance?
Yes.
Okay.
So, okay, sorry, Ken. So this is just a snapshot of the 3 plans, as I explained: the $2,000 deductible, a $3,000 deductible, and the $4,000. The $3,000 deductible plan and the $4,000 are almost identical. They're just, one has a little bit less of a deductible, but it's a little bit more expensive. But they have co-pays for going to the doctor when you get sick, and $75 for specialists or urgent care. So they're very similar, just slight cost difference. You pay a little bit more for that $3,000 deductible. So, and when I come to you with the numbers, I have to kind of forecast where our employees are going to fall, in order to give you an idea. I did do some averaging, but I feel like one of those profilers in the FBI when I look at the employees, like, okay, who's going to go where? So this is going to be really interesting to me to see where people fall, because I don't know. I honestly don't know. $3,000, $4,000 deductible, where they're going to fall. But I always am more conservative, so that you're going to get a higher cost from me. So, and then the HRA, and thank you, John and I worked on this together for some time, noodling numbers and percentages and trying to figure out, what is equitable for everybody. So with the $2,000 deductible, a single employee is $525, For the $3,000 deductible, it would be $825, and then for Plan 3, the $4,000 deductible would be $850. And it's a little bit more for if you have dependents. So it's just up a little bit, which we have the money to do that because we have a nice credit for the $6,000 credit. So that is forecasted, of course, because, again, I don't know where people are going to fall into what plans, but I think we'll be very, very close.
What happens though the next year out when we're not going to get this credit? Will there be an expectation that we keep this 525, 825, 850 as HRAs? And would we, I mean,
Yeah.
it would just mean $6,000 that we would have to budget for coming out of our monies?
And the whole entire $6,000 isn't needed to cover the increase in HRA. I think it was like $4,000 that was needed. So part of that the town will retain. And as far as next year goes, considering that this year we're even, we have no increase at all, next year if we have to have a 3% or 7%, that's not going to be unusual. So, yeah.
Sometimes it's harder to take a 3% or 7% when you've gone from 0.
For the, yeah.
Right?
Yep.
And there's
But
no
it,
increase this year at all.
I know.
And then you're going
Well,
to
it's
7.
for the employees, it's a decrease. It's a decrease in what they're paying. The increase to the town is because we have more employees.
So for employees, if it's a decrease in their premiums for this year, would you be looking at for the next year out in order to maintain this without the $6,000 credit, having to give a significant jump up, or are you not able to project out that far?
You just go shopping again.
Yeah.
Every
Yeah,
year.
it's so hard to tell. Julia doesn't get the numbers to start cracking until just weeks before.
Yeah, January.
Yeah, that's why we're such a tight. Our plan year begins April 1st,
Right.
but she doesn't have the information to put this stuff together until mid-February or
Yeah,
end of February.
usually, I mean, our broker, she hates me today because I've been so, like, trying to, rush it through, and she's been they've been amazing. Saturday morning, 7 o'clock at night, and we were up till 10 o'clock one night punching numbers and doing this. So it is fast and furious. But I understand where you're coming from. Yes, there are years that the employees have to pay more. It just, you don't know. That is what happens. And that's why if you have a year like this, a good year, take it, enjoy it, sock some money away.
Absolutely.
Because you don't know what's coming down. I mean, everybody knows that health insurance is skyrocketing. It's very expensive. So if we have a good year, yay. If we have I have family on mine, so there's quite a bit that comes out of my paycheck to pay for that, and it has gone up and down in the past 10 years. I mean, as high as $450 a pay period, down to $322 last year, and this year I think it'll be $303 if I stay with the high. I will take that. I will take that, $18 decrease, but I don't know what it'll be next year. So
4 years and counting.
But we're always trying to look at ways, like when we moved to the higher deductible plans, the rates came down, but the deductibles went up. And our employees were not used to that. That was a big change for them, and I knew that was going to be a sore subject. They've always had the really nice, like $500 deductible and $1,500 deductible, and all of a sudden, oh, by the way, you have a $4,000 deductible. And that's when, John and I got together and said, what can we do? We introduced the HRA, which helps to fund the costs associated with a higher deductible. So you're always trying to be creative and always trying to think, what can you do to, as we've talked about, and I know, Clayton and Tara are new on council, our benefits attract employees. And they really do. Because I talk to a lot of other small towns who don't do what we do. For a small town to say we're going to pay 40% for the dependents is huge. We get employees because of that. Employees want to work for the town. So it's really important to have a good benefit package. It retains employees. And when you start having rates like these, you start getting employees that now want to add their families. They want to now add their children, which helps us. The one thing that we really have to be vigilant about, and you can't, there's nothing you can totally do to prevent it, but is keeping a healthy workforce. Because the more we can help educate our employees and help them to do things that are healthy, the less claims they'll have. And a lot of that is the preventative care, which is always covered 100%. That's, ACA law, you have to have it 100% for preventative care. But getting, maybe it's a flu shot, or getting your mammogram, or, just going to the doctor and having your blood work done. Those are the kind of things that can give you an alert that something's going on and maybe keep you out of the hospital. And that's why 2 years ago we developed the WHIP program, the Wellness Health Incentive Program, which is a combination of physical activities that you get points for, like playing pickleball or taking a walk or, joining the Y, all of these things that you can do to stay active, so important. And then, of course, the health side, you get points for, having your well, whatever check. If you don't smoke, you get a point. If you go on vacation, like a real whole week off, you get a point.
Early morning runs with staff?
So that's a tricky one. And Anthem actually has a built-in wellness program that is really cool. And employees can earn money, cash. They can get cash just for, checking the things. So it's almost like ours. I still think ours is better. But you can get points for doing those kinds of things. And you see that now across the board. Centera does the same thing. They call me all the time. Like, have you signed up? But what they're trying to do is they're trying to, mitigate the claims as well. So, that's just what we have to aim for and strive for. But, sometimes bad things happen, and we just have to be prepared for that. But yeah, claims and your demographics is what's going to drive the cost up or drive the cost down. So, good question. So, this is what I did last year. It's just a comparison. So this is just a comparison to last year versus this year. You can see that, a couple things have, I can't read it from you. Oh, there you have it. So you can see, dental went up a little bit, but of course we have more people. The waivers have come down. We've changed some of that. Plus we have less waivers. We've had some that have retired. Telehealth is just a little bit higher because we have more employees. But the bottom line is that, we are basically, I can't remember what it was, 0.42% less or something like that. So it was.
So with the Anthem, you're not getting the telehealth? You still have to do that outside?
Yeah, that was never with Centera.
Right, but
That's
I'm just
separate.
surprised that Anthem didn't bundle it with their bundle. Because telehealth's a big thing now.
It's
part of it.
Yeah, they all have some kind of telehealth. I've never had a good experience with it. People can't get through. It's not been good. I've had employees call me at 11 o'clock at night, help, I can't get through to telehealth. It's never been, because it's just part of their. So last year, I had asked our broker to find a standalone telehealth plan that's really robust. And it's a little bit of work to administer it and their billing. And I was like, oh, this telehealth, are we going to stick with it? But then I started getting all this great feedback on our telehealth. And it really works. Like, you can call from your office and get your prescription. You can't, there's certain things that, they can't give you an x-ray, obviously. But if you have strep throat, pink eye, there's a lot of things you can do. And yeah, they do. You literally get your phone and
especially here on the shore, so that it keeps them from a trip across the bridge or something like that. It makes a big difference.
Yeah.
I used it myself this year.
Yeah.
It was really good.
Yeah.
I threw out my back. I couldn't leave the
I know.
house.
Right.
So I called them and got the prescription I needed, and it's a really great benefit.
Yeah. My husband used it for pink eye. And he was trying to get in to see a doctor, because with that, you need to have the medicine really fast in order for it to get cured. And I said, do the telehealth, and had a prescription, eye drops or whatever, and all done. And it's free. There's no copay with the telehealth.
Correct.
And it's $7.50 per employee. So it's good. And I think, like a lot of things, you introduce something the first year, and maybe 6 people use it. And then the following year, people start talking about it, and then more and more people start using it. So I think that more people hopefully more people will use it. And again, you don't want to have to drive to urgent care in Virginia Beach on a Saturday at 5 o'clock.
Is it the same company as last year?
The telehealth? Yeah, we're not changing it. Yeah, see?
I got my prescription set up.
Yeah, see? See? Yeah.
Yeah, it's very efficient. Yeah,
Yep.
very efficient.
It's called Revive.
Yeah.
And-
I think you were excited about it last year when you.
Yeah, yeah, and the employees love it, so we're going to keep that. We're going to keep the wellness and health incentive plan, hopefully. Last year, I think we had about 8 people who did that. I thought that was pretty good. I'm hoping that we'll have more. They get a little bit of money that goes into their HRA, so they're not getting, cash back or anything, but it does help fund their HRA. So there is one, I'm going to show you one slide. Go back to. This shows the decrease. So if we stayed with Centera, it would have gone up 7.72% increase. If our current Centera to the new Anthem would have been a decrease of 6.9%, and the renewal of Centera to the new Anthem was an 8.6% decrease. So again, those numbers are really hard to see because we have more employees. But it would be a huge decrease if we were, again, keeping exactly as it was. So, we had waivers too last year that retired, or we had a couple employees that went on Medicare. And, so things kind of did shift a little bit last year, but we did have several employees that have, come on to the plan, so, and new hires. And we have 9 police officers now, so, okay.
I have a question. With regards to your forecast, you said you're conservative. Can you give me an idea of where we usually end up in a given year? We're saying 260,000.
So funny that you should ask that. Just for grins, I think last year, if we just looked at the health insurance, just the health insurance part, not the dental, is pretty easy to forecast because we pay 100% for the employee, nothing for the dependents, and everybody's on it, and there's one plan. So that is easy. That is pretty black and white. It's just the health insurance, knowing where people are going to fall. And, you have to remember, too, you have somebody that leaves, and you could go 3 months without somebody on health insurance because they leave, and then maybe you hire somebody a month later, but they're not effective till the first of the month after hire, so you've had a break. You have somebody that's a full-time employee that's maybe they're replaced with somebody who's part-time and not on health insurance. So there's a lot of breaks. You're always going to end up, not always, I'm not going to say that, not always, but for the most part, you're probably going to come in under. But I think I was looking at what we did last year, and I think it was projected to be around $16,500 a month with Centera for the employer portion. And I went back and looked at a bill just to see that, in the way that I when I reconcile the health insurance, there's the employer portion and then the employee portion separated out. So I looked at the employer portion, it was like $16,441. So it's pretty close. So yeah, I can't say for sure. I think it's going to be around there. And then, what happens in 6 months if, somebody leaves or retires, or we have several that will probably be moving on to Medicare at some point, so it'll change, but hopefully it'll change in the good direction. So basically, in summary, we've three new positions at the harbor, filled a vacancy in finance. I just explained about waivers retiring and new hires enrolling in coverage that happened. We have a new position that's being filled. So anyways, just it's a good time for the town to be in this position. That's
over 30 hours for full-time, or what is the town?
So for ACA, if you have 30 employees, 30 hours or more, it's considered that you need to be eligible for health insurance. So yes, if you work 30 or more, then you are allowed to enroll in the health insurance, but we do prorate their payroll deduction. So they're not getting, the 90% and the 40%. It's going to be prorated based on how many hours they work, 30 versus 40. So, and we did have somebody who was working 30 or more for a short time, until she went full-time. She was doing that.
To have only 1% increase in your health insurance budget item is
With
spectacular.
more people.
Yes.
Yeah.
With more,
And a better, more robust program.
Yeah.
It's a no-brainer.
And it's Anthem. It's
Yeah.
Anthem. This is not some,
Yeah.
obscure carrier that, nobody has heard of. I mean, this is
And this-
trusted.
and this doesn't just happen, this happens because
Yeah,
of that
her
woman
work.
right there. I mean,
Yeah.
the amount of effort and time and hours that she puts into this is just phenomenal.
I would say it's a good first draft, but when we go back to the drawing board,
Less than a 1% decrease.
I know where you live.
So,
no, that's awesome.
yeah, I just want publicly
Yes.
thank
Thank
Jody.
you.
Yes, thank you so
Incredible
much.
job. It's not just this year, year after year
Yeah.
after year. Those of you who've been here and have lived through these presentations before
Yes.
know that the town benefits enormously from her work.
I've been doing this a long time, even before I came to the town. And I have a good broker.
I'd like to make a motion that we proceed with the Anthem program as outlined in our handout.
Second. Any other discussion on the health insurance?
I'd like to make an amendment to the motion to proceed with Anthem. I propose that the health insurance benefit be offered to town council with the idea that that would be something we do on a pilot basis and then expand to other commissions, employees, those who are being paid by the town. I think it would be a very good way to encourage future participants in town council, maybe reach some of the younger generation and get them to be involved in our town council in the future. And I think it's a great opportunity to support the work that the town council is doing in a way that doesn't cost the town money. My proposal is that anyone who opts to go on the plan would be fully responsible for their full amount of the deductible on a monthly basis.
The premium.
Premium.
So sorry, not the
Yeah,
deductible. Oh, my apologies. Yes, the premium. Yes.
So I'll second that. We can open it up for discussion.
Okay. Open up the amendment for discussion.
I actually think it's a great idea for those exact reasons, because it might encourage more people to run for boards if we decide to expand it to any of the boards that are paid.
Yeah, my comments that we talked before was that it should be to all boards. There's no reason that we just limit it to town
Yeah.
council for our own personal benefits.
Right.
Correct.
It should be opened up to boards and commissions that are considered employees through whatever.
Is that something, Jody, that you would be able to make happen between now and the middle of next week?
No, I'll speak for her, no, she won't be able to do that. So she could maybe do it for council, as I think the way you said it as a pilot program is a good way to start. We're too far into this, there's an incredible amount of work that has to be done between now and then. To try and do all of that now,
Well, can you explain then what is involved? Because I don't see many that will sign up. Even in the age, I see people on the board. So I don't know how many people, we're not expecting everybody to
Yeah.
belly up to this. So I want to question, what will it take? Because I think it is unfair that town council alone takes on this benefit.
What boards are paid?
Historic,
BZA, Historic District Review Board, and Planning Commission. Those are the three. And you do have some that are double dippers. So you do have some that sit on two boards, so it counts as one person. Yeah, you probably have some that would not be interested. I mean, if you're on a Medicare, why would you want to spend, $600 a month or whatever? So,
They would.
John, how many people are on the BZA that this would be an option for?
5?
There's 5 people on the BZA, but how many would?
Oh, I don't, yeah, I don't
Yeah,
know.
I don't know.
I don't know, how
mean-
many are on historic district review board?
5,
5,
And planning commission?
7.
7.
Well, 7, yeah,
Minus
minus the council person, so
So
6.
6.
6 minus a double dipper or 2. So 4. So we're talking about 14 additional people and 3.
Is
4,
the
5,
work
6,
in
7.
just that one-on-one, finding out from every
Well-
group? Having them review it, see if it makes sense and all that?
Yeah, so on Wednesday of this coming week, Wednesday, the 12th, is our open enrollment meetings. So I have meetings set up. I did bring some information, my flyer on the meetings. That's mandatory for all our employees because we're going to have our brokers here. That's when they're going to learn about all these plans, like really the nitty-gritty, like really the plans. There's also going to be a time for them to sit with the brokers if they have specific questions, like, I take this medication, what's the better plan for me? The Plan 2 and the Plan 3, one of the major differences in that plan is that the $3,000 deductible has a more robust prescription plan than the $4,000. They need to be here to learn this stuff, and that's, that's above my pay grade. That's why we have a broker. That's their job, is to sit and really give the plan detail. And then there's also the applications that will need to be completed. And I'm a stickler about that because I want it legible, I want everything done correctly, so they need to sit here and listen to me yell at them on how to fill out their application correctly.
Is that done the same day?
So that's all, no. We always want to give employees some time.
Yeah.
I like for them to have a weekend because a lot of times they want to go home and they want to talk to their spouse and they want to kind of compare, like, well, your plan is like this and my plan is like that. What is the best, what should we do here? So I have put in the paperwork that I need it by Monday, the 17th. And even then, Anthem is freaking out. They're like, that's too late, that's too late. I'm like, I don't have a choice. I just don't have the choice. This is how it rolls at the town. We will be effective on April 1. We may have a little bit of a lag in the cards. So I'm pushing them to be able to get temp cards for us. That's not the end of the
Do you
world.
think it would work if the offer went out to those boards, that if they're interested, they would attend next
They'd have
Wednesday's
to.
meeting?
They'd have to.
I know, just, I know they have to attend. I'm proposing that as a solution. It's on their plate then. It's not on Jody's plate, like initially. They take the initiative to come if they're interested, but we have then offered, maybe it is going to be too soon for them to make that decision, but that's okay. We've offered, and then for next time. But
Well, that's not the bulk of the work. The bulk of the work is after they submit their
I
application.
realize that.
And then Jody's got to process
Yeah.
that, put it into the spreadsheet that she's already built for everybody else. It's going to have to be
is.
reconfigured now.
Yeah.
And she's not going to be able, she's already got plans to go away for this next weekend. I mean, you're going to be running her into the ground, is what you're going to do.
So what is the April 1st date, as opposed to new employees come in? Why wouldn't we have a group decision then that starts in June 1st or whatever?
Well, yeah, so open enrollment is April 1. The only time you can come on to a plan mid-year is if you have what's called a qualifying event. Like you get married, you add a spouse, or, you have a child, can go on, but...
or new hire.
Or new hire, yeah, of course. Yeah, new hire.
Or even be considered new hires, unless it's that group that you were
Yeah,
discussing.
yeah. And this is kind of new, it's just definitely, I know that we would be creating we'd be spinning you all out to a separate category in order, because you're not quite in the same bracket as the employees. So there's a lot of questions that I need to get answered on. Could we bring them in? Could we have a special enrollment? I don't have the answers for that right now because I just found out about this not too long ago. And already I've been, on the phone with our broker, like, can we do this? Yes. What about the fact that council's going to pay 100%? Yes, because, we're going to break you out. I appreciate, John knows. The thing is, you have to remember, it's not just the employee, it's their whole family. So when you're entering this into the spreadsheet, it's every member, every child, every social security number, every birth date, every address, and then you've got to enter in what plan they're taking. It is just, it's not hard, it's just time consuming. And we've got to get more packets put together. Courtney's been helping me with the packets. I don't have enough packets
Is there a
for all
way-
of these people.
Is there a way we can just figure out how many people want to do it?
Well, I
Well-
can tell you, I'm not gonna take it.
I can't.
Neither.
I'm on the poor employee grant.
Well, you have your own company, yeah.
No, but it's government paid for.
No, yeah. So that's the thing, John, is I think about this, it's like, not to overthink it. Maybe we offer it up and we only have
5.
6 people.
Yes, that's
And then I feel really bad to not include them when
Exactly.
it really wouldn't have been a big deal.
Right.
And by the way, I'm going to my son's engagement party on Saturdays, so that is like, and when I told him, I said, I don't know if I can come, that's the weekend before he goes, it's okay, Mom, you don't have to come. Hey, how do you say no? So yeah, I'm going to Richmond. And then,
If I were a betting woman, which I am, I would say there will be, no more than 6.
yeah.
Between all groups
Between
and
all
us.
Because,
Yeah.
I agree.
because really, these boards we're down to 14.
And you got your husband, right? Your
Yeah.
husband, just,
I don't.
Oh, yeah, but mine's not a double dipper anymore. He had to resign from BZA because of teleworking.
planning commission?
Planning commission?
He's on planning.
Yeah,
Oh, but double dipping in that way, yeah. Yeah, but he would be a no. 'cause-
So when you BZA that number of 5 people, is that including
We got
Jim?
good,
Yeah.
It
only
is,
thing.
So
so
actually, it's including Bill Strong, who's now the
Who's now?
BZA rep.
but he doubles, he's,
you don't, it's
Bill,
actually.
Bill wouldn't take the insurance either.
he's not taking it
And
either.
is it really
He's 70
3
years
though?
old.
Yeah,
he's
Four.
on Medicaid.
It's 4, so we're really
Medicare.
down to
And
13,
TRICARE for life. No.
15.
Plus dependents.
Historically,
Yes, but I mean, of
there's
those
no one on
Nobody.
that.
13, how many, 14 are gonna choose
Elise,
at
Elise
13?
is on BZA.
I don't think it's that high.
Yeah.
I have a
That
real,
being 2.
really hard time in excluding.
Yeah.
That's just my,
Yeah.
that's how I am wired. I do not like to leave people out. I would rather invite these people to the party or invite them to this and then deal with it later. I mean, I don't like excluding people. And I do see, and I know John said that I'm not to talk. He said, you don't talk.
I'm trying to protect you, and you're not doing a very good job.
I know, but
just, with the people that are on the current board. I just
we don't want the
see a
fallout.
lot.
We don't want the
We have
fallout.
7 here, I don't think it'll be, I don't think it would be 7 between all groups,
Agreed.
is what I'm saying.
Agreed.
Probably wouldn't.
And I don't know how many of those
So,
are
we have-
extensive family members.
For instance, right now, I think we have, just doing a little quick straw poll, we have one on council.
2.
Who, you?
Yeah,
Two.
I mean, I would look at the 2 plans.
Yeah.
I mean,
2,
I'm
right,
paying a
so
freaking
2.
small fortune.
exactly. I was gonna say, that would be a good option.
So.
I think if,
Some of the other boards are
if
pretty
the
old.
bandwidth is there, that it could be done, and we're, giving a good guesstimate that it would be a number you'd be able to manage, I would propose that we do extend to everyone. I don't know if I need to re-amend my amendment. Okay, so I'd like to amend my amendment and that this health plan be offered to all paid board and commission members.
I'll W-2. I'll W-2. Mm.
Okay.
I'll second that.
All right, is there any more discussion on that?
So, there's a lot of ifs being thrown out here. Can we make this conditional upon the turnout at the open enrollment meeting?
How do you do that?
So I mean, so if we only get 3 or 4 people that show up at the open enrollment meeting and Jody thinks that that she can absorb that, then fine, we'll move forward. If we get 14 people to show up and she thinks it's gonna be overwhelming, then no, we're not.
Well,
Can you do that?
then, yeah, I think that once they're here, I think it would be very hard to turn them away. I would say then, this would not be a big deal. We have Ilse and we have Pam. Maybe we set them up and they can help me with some of the entering, or if Courtney has some bandwidth, it's just some Excel spreadsheets that we need people added into. I mean, I think if we all team together, we can get get it done. Maybe there won't be that many people. Maybe I will just melt.
With Anthem now and your broker though, have they offered up to you like software that would make your job a lot
Self-service.
easier to where it's put in and it's there and it carries over to the next year?
Yeah, I do. So actually, when I got the census from Anthem, and because we're going to a bundle and everything's changing, I have active censuses, and I was just like copy paste. But because we're changing our dental plan, that threw a little bit of a hook in it, because I don't have a census with the dental, and we have a lot of dependents in dental that, I mean, they've been on Delta for 10 years, you know, so some of them are, we don't have them in a census. You don't need a census to get a quote from dental. You need a census to get a quote from medical. Dental, you just fill out the form and, you know. So the census is, if we stay with it, it's a living, growing thing. You know, we update it. So I'm looking at this like, oh, good, now I'm gonna have everybody in here. So yeah, it's just updating. It's just been, it's been a very bad census. It's been a terrible behaving census. It doesn't work as well as it should work. So, but that's just mechanics, you know. It would be easier if the stupid thing worked. But you've heard me in there. So,
All right.
I just don't know how you do that when they're sitting there. If all of a sudden 4 show up, it's all good. If
Yeah.
14 show up, then we dangled that carrot. It's like, well, we're taking
yeah, I don't think we can do that either. I think either they come and we just have to be prepared. I might need a little,
I mean, who's young enough to get insurance on all those boards? Elise, but she's with the
Laura,
builder. She's getting her
I
own
would think
insurance
Laura
there.
might, Laura and
There's not
Melissa.
many children on, you know, with those, associated with those people.
Right.
The work is gonna be in all Tara's
Laura,
offices.
yeah.
I
You're
think
right.
Laura and
I think.
And she's
Melissa.
self-employed. She may,
She might be very attractive.
Same plan as Andy.
Yeah,
I can't see many
Yeah.
people right now doing it.
All right,
Yeah.
well, I guess we'll be rolling the dice.
yeah.
We'll figure it out.
yeah.
So if there's no more discussion, can we get a vote on the second amendment to open the plan to all paid employees, council, and commissions? All in favor? Say aye.
Aye.
All opposed? All right, that second amendment carries. The First Amendment goes away.
Yeah, you amended the amendment. right?
Amended the amendment.
So now the main motion is on the
Back to the
table.
main motion. Is there any other discussion on Anthem Health Insurance this evening? If I hear no more discussion, all in favor of Anthem for 25-26, say aye.
Aye.
All opposed? That motion carries. Anthem
Yay.
is the plan.
No, just a goofy question, but will that help with the numbers even more, if there's more on there?
Wait, say that again, Andy?
Will it help the numbers even more if there's more participants? Or does it have to do with a
Age.
big,
It depends.
Yeah. So large groups are 100 and over, which we won't hit. It's really your demographics and your claims.
It does give us some younger people.
Yeah. Oh, yeah. Yeah. I mean, and we do. We kind of bounce out. We
Yeah.
yeah.
So it depends on the claims and the demographics.
And-
You can't really say much more than that, yeah.
That's why last year, when we were here a year ago, we had a 3% decrease with Centera. And that's unheard of, but our demographic changed a lot last year. We had a lot of new hires who were, younger. This year, we've had a mix of new hires, so it's kind of bounced out. But I think that the fact that we only had a 7.7% increase with Centera is because, we're a well-balanced organization with age,
Like you said, that's not a bad increase.
It's not, no, it really is
We're
not.
supposed to see 20 and 30%.
Yeah, it really is not. I was surprised, so we'll just really need to talk about, like, communication. Like, how do we got to let all the planning boards know what's going on.
Send them all a message. I mean, again, if they don't get the word, they don't get the word.
Yeah.
I mean,
And I would-
they'll be able to do it next year,
I'm with John on that. I mean, let's not go crazy with it. I would put out some kind of correspondence to all the members, and if they want to attend Wednesday, great. If they don't,
yeah,
If they
from the
don't
one.
attend Wednesday, they can't.
that's
right.
correct.
Yes.
That's right.
That's correct.
I think that some may come just to learn about it, and they may just be curious.
I mean, that's why I would be going.
Right,
mean, they would just be curious on it.
Right.
See which one's better for us.
All of it's serious.
So I will give you this.
And I do have the premiums attached to it.
Thank you.
Thank you.
Jody, thank you for all of your work on this.
Yes, thank you so much.
Fantastic, and for turning everything around so quickly today.
My personal mail's been coming to the office lately. Where I live. It's, this is one of my favorite things, actually, it's my job. I've always found that exciting and enjoy it.
Well, thank you very much again.
We need to put a cook top in there for you.
Yeah.
Well, I got a microwave, a cook top.
Good job.
So, John, do you have any other comments this evening?
Couple of quick ones.
All right.
So, Ryan wants to get a picture of all of us at the fire hall to help promote the new truck. So we were thinking maybe trying to do that before the regular meeting on the 20th. Would everybody be available before 6 o'clock to get over there, take a picture, and then come over here?
So they have the new fire truck,
The 20th, a regular meeting. Yeah. Would that work for everybody?
What's, you're thinking 5:30?
5:30.
Yeah.
And we'll have the photographer and everything ready to go. They want to give the town credit and some recognition from the PR for it's called a push event when they kind
Well,
of
now
push
they
it.
need a new roof, so they need
Yes.
pictures to
Yeah.
go with it.
Yeah, exactly.
20th?
20th.
20th, yeah, so just be half
Thanks,
an hour
everybody.
before our normal meeting on the 20th,
Great.
okay? Town council clothing. I've kind of dropped the ball on this, we've got 2 new members, and I haven't, reached out to see about getting, we try to get, shirts or sweatshirts or something that identifies you as a council member, so if we're doing public events like Cape Charles Day or the ice cream social, you're recognizable in the crowd as wearing something with the town logo on it. So we did have some light blue polo type shirts that not everybody cared for. So anyway, since we haven't ordered anything yet this year, requests, what would you like us to get?
I like the blue shirt.
Well, Tammy likes to put a
shirt underneath it.
Blue long sleeve shirt
Underneath it.
That was really smart.
It was.
She turned it into a long sleeve
Long
shirt.
sleeve shirt. Because our events that we wear these at are always in cold season. And those things are like nothing. I was going to say a vest, or if we do the golf shirts, again, I just think the fabric's not the best for everybody.
I like the vest.
Maybe, yeah, because then you can put whatever you want
Underneath it, yeah.
Would you prefer a vest like this?
Does it
Yes.
have to be olive green?
Yeah, please no.
It has to be exactly like this.
Yeah.
No,
it's not a good color.
We typically, the town color, it was blue, so we kind of tried to keep it, it should all have the same color, so you're
Yeah.
identifiable to the public. I don't care what color you pick, we have used blue in the past up until now.
Maybe
A light blue.
Light blue? Is that what you're saying?
Yeah.
I think that's lovely.
Okay,
Yeah.
all right,
Color of our logo.
so,
I would even like to do a quarter zip.
I would too.
we'll do that. Then the last thing I wanted to touch base on is, thanks to Tammy and to Courtney who are helping to put this together, for Cape Charles Day, we're going to be honoring Smitty after the cleanup. And so we're going to be doing this at the Harbor East Park, not at the Central Park, because of Smitty. And a really good idea was to get one of Main Street's commemorative benches for Smitty. So I thought that would be really good. And take donations for it. So the town doesn't normally do this, but if it's okay with you, I'm going to allow the town to take donations. Now I'm just going to record it to miscellaneous revenue, and then I'll expense the bench out of my contingency fund. Okay, so if that's okay with you, that's
So Main Street has already ordered the bench, and we're going to ask people to make checks to the town of Cape Charles.
Yes.
And I'll just collect those and give them.
So checks or cash.
Yeah.
We could,
Or cash, yeah.
we'll take it, either one, and then,
Yeah.
then when we get enough, we'll write the check for the
Yeah.
bench.
Are we doing food there?
Oh, yeah, everything will be, the
Everything's
whole
normal,
picnic will
the normal
be.
Cape Charles Day.
In
stuff.
order to help Jody out, we're doing chicken dogs and turkey burgers.
John, I just realized I will not be here on the 20th,
No, on the 20th,
for the 20th,
Thursday.
for the picture
Oh,
meeting.
okay, okay.
I will not be here.
Oh,
Okay.
Yeah,
We'll bring a poster.
there
Yeah.
you go.
So,
And
Just gotta make sure we get pickles. Don't ask why.
Courtney Pickles, got it?
pickles, there it
And
is.
So-
I'm personally reaching out to his brother, so we
Yeah.
can pass the word up to his,
We've done,
Adria's
we have
already
done
made
that.
a numerous amount of
Yeah, I've
calls.
called Adria,
Good.
and Adria has gotten in touch with family already. Just a couple more details about that. We have the Waterman involved. Abby Dempster is going to make a wreath like she does for Blessing of the Fleet, and we've asked the Waterman, two of his friends, to take it out and kind of do the lane of that. We also are going to have what's called a message in a bottle. So we're going to be able to have little slips that you can put a message in, put in the bottle, and they're going to take that out as well. And then we're going to have buoys that for people that can just kind of sign, and either the Shanty or the Harbor. Everybody's been great about working with it. So a couple of things. So the kind of plan is for the traditional time, like 12, everybody come, get their food and gather, and at 12:30 we'll start the ceremony. I haven't had a chance to talk to Adam. If you're going to be there that day, I have you in my mind to kind of kick things off, and then I'll talk, and then Steve Bennett is going to talk just kind of from his time with serving with Smitty, and I think someone from the family wants to speak. The Watermen don't want to speak, but they're going to be there. But we'll share stories, otherwise. So if there's anybody else that wants kind of to be a part of that program, I've asked the Coast Guard to be there to bring in the colors, but I haven't gotten a confirmation on that yet.
I'll talk to the chief, I just talked to him.
Oh, good. I sent him
Yep.
an email. Tell him to answer my email.
Yep, I'll talk.
And ask him if Jim can work at their office.
Okay.
That's really what's most important. So he doesn't have to drive to Portsmouth.
Okay.
So before that, the Cape Charles Day will be doing the normal,
Yeah.
the flow. So, we'll meet down at the beach gazebo, we'll break up and do our cleanup around town. But you do not have to do the cleanup to come to the picnic at noon.
Yeah.
Okay, that's important, make sure everyone knows that. If you want to come out and help clean up the town or clean up your own yard, that's fine in the morning.
But come to the picnic.
But please come to the East Harbor Park at noon, whether you do the cleanup or not.
Right.
I would suggest getting more than we normally get for hot dogs and stuff.
Yeah, okay.
Because I think this is gonna be fairly
Yeah.
decent turnout.
Okay.
So Courtney's done a great job. She's done a couple of different flyers. She's doing she's one for just for the Smitty portion that the Harbor folks are handing out to the Watermen so that they have that special kind of invite in doing that. And we're going to make some adaptations to include, we'll be taking donations for a memorial bench on it. And then I'll get that on Facebook, so please share it as you see it. Because I think the main thing is, number one, letting people know that part's going to be for Smitty, but that the change of location, like the confusion. So she's going to do some signs at the park to guide people over to the right spot.
You guys are gonna get email tomorrow with all the details and the cleanup now, and
Yeah.
kind of got finalized.
One more suggestion, if we go over whatever the bench is, are we gonna
Yes.
donate it to the Watermen's Memorial Fund?
That's what I thought. Yep. Yep. I thought we need to get about close to 2,000
I thought it was 2,500.
No, 2,000 for Main Street. And then anything over, I thought would just automatically go to the memorial.
That's a great
Yeah,
idea.
Somebody would like that.
yep.
Yep. Oh, absolutely.
Since we're talking about the donations, can we just, since people are gonna make checks out and it's gonna go to the town, can we just make sure that we circle back and make some kind of an announcement of here's how much we raised?
Oh, yeah, of course.
As soon as we
Yeah,
know.
absolutely.
Because sometimes that piece gets lost and,
Yeah.
and it's a really good way to.
Yeah, right now I'm asking for people to actually give the check to me as opposed to send it or something, because then, it's just the town of Cape Charles, like what is theirs,
Right, right.
And so then I keep it all together so we can kind of collect it, and then I'll of course take it that day, but I'm hoping that people will start right away, kind of just dropping
That's so
off.
great.
Can the town set up a Venmo or anything like that? to
They
rip people?
can't.
They
Yeah,
can't.
we're not really set up for that.
Okay.
And I asked, Miriam was great. I asked her if we could set up a credit card, kind of a, a link to kind of do, and it's just, we're just not meant to. I mean, to do it like we're doing it is a stretch.
Okay.
But,
What if
I thought about
most
Main,
people at the
yeah.
square and
I thought that I was gonna ask Main Street, I just hadn't done that yet. So I didn't want to assume, but to see if we could use Main Street Square kind of thing, so we could take, cash that way and donations
cards
the
you
day
mean?
off, credit cards.
Yeah.
Mhm. Yeah,
All right.
but,
Okay.
John, there were two things I was going to ask you. If you
You want
talk
to-
to us about Rick's Housing, can you just let everybody know what that was? Because it was before our meeting.
So our new town manager is making arrangements for his trip over here. He's arranged for temporary housing. He's going to be renting a small home over in Oyster until his home in Colorado sells. Once he sells that house, then he'll look for a permanent home here. But he's all set to start on time.
Now, for Virginia American Water, you had sent out notice to us that the rate was finalized and it's going to be, do you know when it's actually going to hit?
Yes, March 1st.
March
It's
1st.
already happened. And within, so I don't have the rates in front of me, but just for the general public, one of the benefits that we pursued this sale for was that we would get to join the consolidated statewide rate system of Virginia American Water, which means we have a much larger group of people, and it actually brings our rates down. So even though they're making major investments in our system, our rates are going to come down. Well, I had to go through the SCC, the State Corporation Commission, the regulatory agency. That just got approved. And so starting on March 1st, the rates are going to come down slightly for water, but significantly for sewer. So when you combine the two, it's a nice little drop. And it's retroactive to May of last year. So you will get a credit. You'll be getting a credit on your account for the difference between what the rate is and what was paid back in May. So it may take up to 90 days to get that credit, but just it's a really,
will they be doing a press release?
that's what I understand.
Because
So
we need credit for that. We said we were gonna do it, and
Yeah.
we've done it.
Yep.
Yeah, I've worked out a year's worth of billing with the new rates, and my whole bill expects to go down 50%.
Wow. That's great. That's
So
great.
again, it's all based on how much you use.
Use,
Right.
right.
Keep preaching.
Mine won't
Go
go-
over 2,000 gallons.
Mine won't go down
You're
50%,
gonna be
but that's
paying.
okay.
It's
It's not gonna go up.
It's not going up.
That's
You know,
I'm all right with that.
If we had kept this system, these
Yeah.
rates would have skyrocketed to pay for the
Yeah, the improvements.
infrastructure that's going
Yeah.
on right now.
Well, we
So,
may not be talking about the two things we're talking about right now either.
Anyway, any other questions for me?
My pool, filling my pool.
Nope.
That's all I had, Mr. Mayor.
All right, anybody else have any comments this evening?
I just have one. I have a couple of notes on the strategic plan document that I know Ken had one that he's going to bring forth. We didn't really flesh out the enhance the visitor's experience any, so there's not bullets in there. So I'm going to propose some that I'm going to bring. I just wanted to kind of give a heads up so that we have that kind of completed through that. And the other thing is I felt like we missed maybe one item under community engagement, and I have an idea, so I'm going to just include that. So expect to see that at that meeting.
So yeah, again,
You have one?
thanks for reminding me. I was going
No.
to mention that again, just for the public, and that we're going to call a public input session. That's not your typical come here, get 3 minutes. It's like a mini town hall meeting. So we get to do an exchange. You can come here and you can ask us questions and we'll answer them. So anybody has any input on the strategic plan, it's very important. It's online now, and we'll be doing that at the beginning of our March 20th meeting. So people are encouraged to come, tell us what you think about the strategic plan, and if you can't be here on the 20th, you can send written comments to the clerk. Just make sure she gets them before 4:30 that day.
Plus, I'm running.
First
the
one,
meeting.
you'll have fun.
Yeah, great.
That's an
I'll
easy
call in-
one.
I'll call in here all night.
All I know is make sure that gavel's right there.
Yeah.
Yes, indeed. All right, anybody else this evening? I hear no more comments. Can I get a motion for adjournment? So moved.
Second.
All in favor?
Aye.
Or adjourned.